So hello everyone and welcome to Moorgate Andrology. I'm delighted once again to be joined by Dr Greta Pecuilyte and
hello everyone.
And today we want to talk about erectile dysfunction. So Greta, tell us a little bit about what are the main causes of erectile dysfunction in men?
Firstly, I would like to tell you that in Massachusetts male aging study, which surveyed some men aged between 40 and 70 years old, even 52% of males reported some degree of erectile dysfunction.
Really?
Yes.
That's an incredibly high number.
That's an incredibly high number. In addition to that, more than 70% of males aged more than 65 are suffering from ED as well.
Oh, and presumably when they're over 65, there's other medical conditions going on that may be causing the ED. Do you think that's right?
Yes, definitely. And these are the main factors associated with ED and like precursors of that as well.
And what are these precursors mainly?
Mainly it would include hyperlipidemia, hypertension, diabetes mellitus, morbid obesity, metabolic syndrome, and even smoking is associated with that.
Really? So if you're a heavy smoker, then erectile dysfunction could strike even when you're under 65, presumably.
Yes, you might definitely suffer from it in some period of your life.
I understand there are 3 key areas of erectile dysfunction. Could you tell us a little bit about those?
Referring to ED definition proposed by International Society for Sexual Medicine, there are 3 main etiological groups of erectile dysfunction, and it would be the first one psychogenic, the second one organic, and the third one is mixed. And this is the most common type. So regarding psychogenic ED, it might be broken down to generalized and situational. And the examples would be like stress, anxiety, various problems within the relationship.
Okay.
Also, it might be some special conditions like those when a person cannot maintain long relationships or cannot get closer to a person, and there are a lot of psychological conditions that might be associated with ED, and some of them are lifelong, others are acquired. So that would be like these examples I told you. Regarding organic causes, it would include neurogenic, which means associated with central and peripheral nervous system. So regarding organic causes, it would include neurogenic, hormonal, arteriogenic, also associated with blood flow to the penis or the veins, and drug-induced.
Okay. So really, there seems to be a sort of a wide variety of causes of erectile dysfunction, whether you're young or whether you're old.
That's right.
And presumably the advice would be from a doctor that if you start to have problems with your erections, then seek advice from a doctor or an andrology clinic as soon as possible so the cause can be found.
Definitely.